guys, welcome to AMC Doctor. Today in this video, we will be discussing about breaking bad news. Everything that we will discuss today will be timestamped down below in the description box. So let's start with the definition of bad news. It is defined as situations where there is either a feeling of no hope, or a threat to a person's mental or physical well-being, or a risk of upsetting an established lifestyle, or where a message is given which conveys to the individual fewer choices in life. And for doctors, breaking bad news to patients can be a very difficult task. However, the complexity of this task can be simplified by approaching it in a stepwise procedure. And the goal is to deliver the news clearly, honestly, and sensitively so that patients can both understand and feel supported. And to accomplish this goal, we have got the SPIKES protocol. And this is a 6-step strategy that helps you formulate a plan for breaking bad news. So here, the S stands for setting, P for perception, I for information, K for knowledge, E for empathy, and S for strategy and summary. And it is recommended that you follow each of these steps in sequence where applicable. Now, let's start with the first step, that is getting the setting right. So here, first is the physical setting, where you need to arrange a quiet room where you can maintain privacy and have an uninterrupted discussion. Make sure you arrange some chairs so that the patient can sit down and relax. Maintain eye contact throughout the case so that you can maintain a rapport. Then encourage a second person to be present if appropriate. So here you need to ask the patient if they want to have someone else with them for support. But at the end, it is their choice. And finally, arrange to provide some other methods like reading materials or videos to convey the information. But for the AMC exam, you don't need to worry about these physical settings as the role player is already in a room and well seated. But make sure you maintain eye contact and ask the patient if they want to have a family member with them for discussion. Now in step 2, that is perception. So you need to find out what the patient knows or perceives. So here you can ask some open-ended questions in order to assess the patient's understanding of the situation. For example, you can ask these questions like, what have you been told about your situation so far? Or what is your understanding of the reasons we did the biopsy? So some patients may be quite aware about their medical conditions, while others may not. And depending on that, later on, you can tailor the information to what the patient understands. Here you can also ask about any symptoms that the patient has been experiencing. Now in step 3, we need to get an invitation from the patient to share the information. So what we mean by this is that some patient wants to know everything about their medical condition while others don't. And that's why you need to ask the patient about how much information do they want. So here are a few examples of how we can phrase them. So you can ask, when all the results are available, some patients want to know in detail what the results are and what they might expect in the short and long term. Other patients prefer not to be given this information unless it is really necessary. How do you feel? Or you can say, at this stage, do you want to know all the information or just the basic information? I can elaborate on it at a later stage if you don't want all the information right now. But in exam or in real life situation, you don't need to tell these exact lines. But what's important is that you ask and assess how much information they want. And in AMC, as this is an exam, the role player will always tell you that they want to know everything about their medical condition. Now, the step 4 is where you give the knowledge and medical facts. So this is the step where you're actually breaking the bad news. So initially give a warning sign to the patient that the bad news is coming. For example, you can say, I'm sorry to tell you that, or unfortunately, I've got some bad news to tell you. And then give the diagnosis and then pause for a few seconds and let the patient absorb the news. And when you're giving the diagnosis, use simple, plain language. Avoid technical jargon such as tumor, growth, metastasis, illness. And if the person has cancer, then use this word. And also avoid words such as nasty growth because it can obscure the truth and can cause misunderstandings. And as in step 2 and 3, we have already assessed patients' understanding and the amount of information they want. So you can tailor the amount of information to the patient's request. And make sure that you're giving information in small chunks and regularly checking their understanding. So the next step is addressing the patient's emotions with empathic responses, and this should be done simultaneously with step 4. So when you're giving diagnosis to the patient, they're going to react in different way, and responding to their emotions is one of the most difficult challenges of breaking bad news. They can start crying, or there can be silence, disbelief, or even anger. In such situation, it's very important that you acknowledge and validate the person's feelings and respond to the person's feelings with empathy. So you can use phrases like, I wish the news were better. I was also hoping for a better result. Or I can see how upsetting this is for you. And if they are silent, always ask them what they are thinking or feeling. And apart from this, you can use gestures like moving your chair closer to the patient, offering tissue or water, or touch the patient's arm and hand where appropriate to provide reassurance. So the final step is strategy and summary. Here you need to discuss the treatment plan with the patient and provide reassurance that there will be involvement of other specialists as well, and also provide information about different support groups that are available. And while explaining, always check patient's understanding and address any further questions. Encourage family meetings, that is to help them tell their family members about their news, and arrange a further appointment to review. So these are the 6 steps of Spike's protocol. Use this tool to approach any Breaking Bad news case for your AMC exam. So finally, I've got a few general tips. So maintain an appropriate level of eye contact throughout the station. Maintain an open, relaxed, yet professional body language, that is uncrossed legs and arms, leaning slightly forward in chair. And acknowledge what the patient says by actively listening to them, nodding and maintaining eye contact. And also offer tissues and water where appropriate. So that's it for this video. Hope it was useful. Thank you so much for watching.